What's tight? Hip flexors. Okay? So what's our muscle opposite to hip flexors? Glutes. All right? Glute med. So if we wanted to do hold relax for this, how would we do hold relax for her tight hip flexors? So I would have her pull forward, right? So I would bring her to her end range, and then I'd say gently pull forward into my hand, right? So she's contracting to pull forward, and then I would have her relax. All right? And we're using autogenic inhibition. Now we're using the agonist, the muscle opposite, all right, which is her glute max. And then what's this going to use? It's going to have a reflex sort of, right? A reflex. So it's going to use what kind of inhibition? Reciprocal, all right? And what receptor? Muscle spindle, all right? Which senses what? Stretch, all right? Which senses stretch. So that's going to send a sign. So I'm going to have her actually contract, okay, the opposite muscle, all right, which is going to fire the muscle spindle, all right, which is going to reciprocally inhibit her hip flexor, all right, so we can stretch her hip flexor. All right, so what I have her do is, the short muscle is called the antagonist, and it's preventing the full movement, okay, of our prime mover, okay, or our glute max. So what I have her do is a concentric contraction at a very low level with no resistance, with low level or no resistance of the muscle opposite the range limiting muscle. And the movement is slow and not ballistic. So what I have her do is, I'll bring her like this, and then I'll have her push backwards. All right, push back towards my hand. And just a gentle resistance, keep pushing, for 5 to 10 seconds. All right, gentle resistance. All right, gentle resistance. Gentle resistance, all right, till I get to the end of her range, all right, then we stop at the end of the range, and then what I do is I stretch her into her new range. And how long do I hold that stretch? 30 seconds. All right, and then after 30 seconds, I could repeat that. All right, so her range limiting muscle is her hip flexor. Right? So I'm having her contract the muscle opposite that, which is her glute max. All right? Agonistic contraction. So she's contracting her agonist. She's pushing back gently. All right? Keep going. Keep going.